Hello, so the patient we're about to go see right now is Michelle. Michelle is a 35-year-old Mexican-American woman that works currently as a secretary and is married and has one 5-year-old daughter. She seems to be a little bit tired throughout the interview, and her vital signs are a blood pressure of 138/86, a little bit elevated, heart rate of 88, respiratory rate of 18, temperature is 98.8 Fahrenheit, respiratory is 98% on room air, and her current height is 5'2", her weight is 190 pounds, giving her a BMI around 35, which is a little bit on the obese side. Hi, I'm Stephanie Barron. I'm the PA student here today. Can I have your name and your date of birth?
My name is Michelle Drang, and date of birth is 11/09/1990.
All right, so here I see that you're coming in for some sleep concerns. So I just want to let you know to feel comfortable to speak about anything. We're here to help you and making sure that you are getting better sleep. So first off, do I have your consent to continue?
Yes.
All right, so I'm going to ask you some questions first. The first question is, how's your sleep? What time do you usually go to bed and wake up?
My sleep is okay. I think it could be better. I usually try to go to sleep around 11, sometimes midnight, and I have to be up at 7 for work.
Okay. Do you ever find yourself waking up in the middle of the night, maybe like gasping for air or snoring?
Yes, I think actually I do, because my husband does say that when I gasp for air or snore abruptly, it does wake him up and startle him.
Okay. Have you noticed feeling really fatigued and tired at work despite sleep or?
Yeah, all the time. It doesn't matter how many hours of sleep I get at night. I usually wake up feeling really tired.
Okay, I'm sorry to hear that. But do you drink any caffeine or any energy drinks to kind of waking you up during the day, and how do you see that affect you?
Oh, definitely. I drink coffee every morning, and
Okay.
then around 5 p.m. I do open an energy drink, and I think it helps me just for that moment.
Mhm.
Then I still feel tired at the end of the day.
Okay, I see. Is there anything in your life currently that you think is stressing you out or having an impact on your sleep schedule?
I think the most stressful thing right now is my daughter. She's 5, and she's been having some behavioral issues in school, so that makes me really stressed.
Okay, that's very understanding. Have you had any other big life-changing moments, like movement of homes or anything drastic happen in your family?
Yeah, we actually just moved here from Florida.
Okay.
So I think that's a contributing factor of my daughter's behavior too. So
Okay.
both of those factors make me really stressed.
Yeah, I'm sorry to hear that. Hopefully everything will be okay. My last question for you is, do you do any exercise? I saw that you mentioned that you're a secretary. I know usually secretaries are sitting down a lot. When you get home, do you do any physical activity, or do you have any exercises that you like to do?
No, I try to, but when I get home from work, I'm pretty tired, so I just want to go to bed.
Yeah, that's very understanding. So here, what I'm gathering is that you wake up and kind of can't breathe and you're snoring. And with all the other stuff that we have gathered, such as your blood pressure and your BMI, it does look like you might have a risk of obstructive sleep apnea. So this is just basically your airway isn't really functioning while you sleep, and this could be due to many different factors. But we're gonna do a little questionnaire to see if that risk is high or not, and then we can move forward.
Okay.
All right, so this is called a stop bang. So I'm gonna ask you a couple questions and then just answer them as you can, as well as you can. So we're gonna go ahead and start. So first one is, do you snore loudly, louder enough to be heard through closed doors or louder than talking? Does anybody notice this snoring?
Yeah, my husband does say I do snore.
Okay. Number 2 is, do you often feel tired, fatigued, or sleepy during the daytime?
Definitely.
Okay. And then, has anyone observed you to stop breathing or choking or gasping during your sleep?
Yes.
All right. And then, have you been treated or do you have high blood pressure?
In the past, I did, yes.
Okay. I saw your records before this. Your blood pressure is still a little bit high, so we can definitely talk about that. Is your BMI over 35?
I think so.
Okay, we just looked at it. We calculated it. It is around 35,
Mm-hmm.
but we can also think of some future modifications to help that.
Okay.
And then age over 50, you're 35, you said. So that's a no. And then we measured your neck circumference, and it is not bigger than 16 inches, so we should be good. And you're not a male, you're female, so usually males are more likely to have obstructive sleep apnea, so it's just a factor we want to look into.
Okay.
All right, so thank you for sharing all this information and feeling comfortable. Do you have any questions or anything so far?
No, not at the moment.
Not at the moment. Okay, so we're gonna go ahead and look at your assessment, and then we're going to move on forward on what our plan is and what we should be doing next.
Okay, sounds great. Thank you.
All right, welcome back. So we looked back at your study, and you got a 5 out of 8 on the Stop Bing questionnaire. So this does mean a moderate to severe risk of having obstructive sleep apnea. But don't worry, usually obstructive sleep apnea can be fixed if we catch it early on. So in order to do this, we're going to do a sleep study. So the sleep study can be done either here in the lab or at home. It just matters on what you're more comfortable with or what works better for you. This sleep study should be rather quickly, should not be uncomfortable at all. After this, if it comes back as positive, we would give you a CPAP therapy machine. So this machine would help you sleep at night. You basically just kind of plug it in and it kind of brings some air to your throat. This just helps you breathe a little bit better so you don't wake up in the middle of the night snoring or gasping for air.
Okay.
So as I mentioned, the first step is doing a sleep study. Do you think you would be able to come into the lab to do the sleep study anytime soon, or would you rather prefer a at-home method?
I can come into your office to do it, but I do have a concern. I am not working as often lately, so I'm just wondering if there's any support programs or resources that I can refer to financially.
Yes, of course. We have some social services downstairs that can talk to you about that. So if the sleep study does come out in that way that you have obstructive sleep apnea, we can definitely talk to them and try to find a way that best works for you.
Okay, thank you.
Yes, of course. So another really big aspect of this is having emotional support. Do you think you have the emotional support at home to help you, make sure that every night you use the CPAP machine and that you're kind of held accountable for any lifestyle modifications that we're going to
Yes, of course. My husband is great.
All right, I love to hear that. That's very good. So as I mentioned, not only is CPAP therapy the only treatment that we have, there's also some non-medication, non-device, such as lifestyle modifications. So as we looked, your BMI was a little bit higher than normal. Weight is a big factor that can play into obstructive sleep apnea. It's not the only one, but it definitely will help if, we stay a more active lifestyle. I know you mentioned you work a lot and it's harder to get your steps in, but if you can find the time, maybe on the weekends, maybe try to find it as a fun way to spend time with your daughter. As you mentioned, maybe go on a walk or something, just to get a little bit more exercise in there. And also exercise does tend to give you more energy, so that could help also with your energy.
Okay, I will definitely give that a try.
Not only that, but I know you mentioned you have a very stressful life with your daughter and work, but hopefully the emotional support from your husband will be great to help. And hopefully with this machine and everything else, your sleep will get better and that will make you feel better every single day as well.
Okay, thank you so much. I'm so excited.
Yeah, lastly, the only thing I want to mention is the caffeine and alcohol intake. I don't know if you drink at all, but maybe in the weekends, maybe you like to drink a little bit. But you did mention a lot of caffeine. This definitely does mess up your sleep schedule a lot, and it kind of alters your whole, sleep schedule. So if we want to just avoid as much caffeine as we can, I understand sometimes you need your little pick-me-up coffee in the morning, but let's try to avoid any caffeine when it comes closer to nighttime.
Okay, I will try that.
All right, so yeah, do you have any questions, anything so far?
No, that's it. Thank you so much for your help.
Yeah, of course. So we're gonna go ahead and do that sleep study, and then we'll see and move on from there.
Okay, great.
Okay, so looking back on my interview, there's definitely some aspects that I feel like I addressed really well, and there's also some that I wish I'd spent a little bit more time on. First off, I feel like I did a really good job on making the patient feel comfortable enough to express their concerns and any questions they had. I think it's really important throughout an interview like this to constantly ask them if they have any questions. It's really easy to kind of get lost in the process of doing the questionnaire, telling them their diagnosis and any further treatment, and forgetting to ask them and making sure that you're addressing any concerns that they have. Constantly giving them an opportunity to do that will also make them feel more comfortable. And also, it's really easy to forget any questions that you get while the provider is speaking. So I think I did a really good job on that part. Another aspect is I did address the stressors in her life, such as her child who's having some behavioral problems. I do wish, this is a thing I would work on a lot more, is to kind of shine more light on that and make sure that she is having the emotional and support that she has for that problem. I did not ask if she was taking any therapy or if they were doing anything in regards to addressing her kids and her child's problems with that. So I do wish I had asked a little bit more about that. I am glad that I did ask about having the emotional support back at home. I think with something like obstructive sleep apnea, it's really important to have somebody at home that understands what's going on, and not only that, but is willing to help and help adjust your life to that. A big thing about obstructive sleep apnea is the lifestyle modifications. Lifestyle modifications seem really simple at first, but it's really hard to really implement them in your day-to-day life, just because we as people build habits. They might not be the healthiest habits, but we do build some habits, and it's really easy to kind of start doing these lifestyle modifications and then stop them abruptly. And the most important thing is about being consistent with them to see real results. And if you have that emotional support at home and you're able to express that these are changes you need to make, it's really helpful to have somebody to hold you accountable and also kind of support you through that. I recommended maybe going on a walk with the family together as a way to spend family time, but also, work on increasing that physical activity. That way the BMI number can also decrease, which would help with her sleep. I think it's really helpful to think of ways that kind of incorporate a whole family together when it comes to addressing any problems with somebody who isn't a family. That way they don't feel alone and not a little bit more stressed that they need to do all these things on their own, but can kind of take it together as a family and grow together in that aspect as well. I would say overall I did address every concern about that correctly. I did my best to explain what obstructive sleep apnea is more in a layman's terms way. That way they don't find themselves overwhelmed, and also kind of they get an understanding of what's wrong and can also hopefully go home and explain it to their significant others as well. Overall, I think the interview went really well. I would say there's always something to work on. Like I mentioned, I wish I had asked a little bit more about her child and what they're doing to address that problem currently. I did try to make sure that everything was accessible for the patient, such as transportation to getting to any appointments, and also financially covering any CPAP machine or any other things that they might need. So I made sure to have that addressed in my interview. But overall, I do think it went really well. I look forward to learning more about how to communicate with patients and also making sure that they feel comfortable enough to address all their concerns. Thank you.